Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Newer opioids include fentanyl. Fentanyl is most commonly used. Fentanyl is a cardiac stable. It is the most cardiac stable. Fentanyl has a half-life of 2 hours. All formulations of fentanyl can be in the intravenous, intramuscular, transmucosal, lollipop, patch, epidural or intrathecal form. Alfentanil is a newer opioid which is faster acting. It has shorter duration of action. Alfentanil has maximum chance or risk of causing wooden chest syndrome. Sufentanil is the most potent human opioid, and sufentanil is 500 times more potent than opioid. Sufentanil is opioid of choice for intubation. Remy Fentanyl. Remy Fentanyl is ultra short acting, that is, it acts in 10 minutes. Remy Fentanyl is opioid of choice for daycare surgery. Remifentanil is metabolized by esterases. So remifentanil is opioid of choice in renal patients. So in remifentanil is the disadvantages of remifentanil. Remifentanil has glycine preservative. It contains glycine preservative, so it can result in motor paresis. As a result, remifentanil is not used for epidural or spinal anesthesia. Remifentanil can cause acute intolerance or hyperalgesia.
Summary. Newer opioid agents. So newer opioid agents include four drugs: fentanyl, alfentanil, sufentanil, and ramifentanil. Fentanyl is the most common one, and fentanyl is most commonly used. It is cardiostable, and it is most cardiostable. Half-life is 2 hours. It is present in all the formulations like intravenous, intramuscular, transmucosal, patch type, epidural, and intrathecal. Second, alfentanil. Alfentanil is faster onset with shorter duration, and it has maximum chance of causing wooden chest syndrome. Sufentanil. Sufentanil is most potent human opioid. It is 500 times more potent than opioid. It is the opioid of choice in intubation. Remifentanil, it is ultra short acting with onset of action for only 10 minutes. It is the opioid of choice for daycare surgeries. It is metabolized by esterases, and it is the opioid of choice for renal patients. The disadvantages of ramifentanil are it is a glycine preservative, so it causes motor paralysis, so it cannot be used for epidural and spinal analgesia. It can also cause acute intolerance, and hyperalgesia has the side effects.
thank you and thank you for watching.